Our doctor today is Dr. Kristin Collier. She is a general surgeon at Phoebe Sumter, and I want to say thanks for driving over today.
Well, thanks for having me.
So far, America's...
We're okay right now.
Just cold.
It's just cold.
It's just
a cold day.
Well, you know, there are 7 on this list that you've given me, and I've mentioned one, colon cancer.
Yes.
For whatever reason, I associate it mostly with men, but you're saying it's just as prevalent with women.
Absolutely. We see just as much colon cancer in women as we do men, and so it's as important for women to come and get their colon cancer screening, which really just involves a colonoscopy. And we do a lot of endoscopy in America, so they do a lot here in Albany, and it's really not a terrible procedure that people think that it is. We recommend that women come in starting at the age of 50 to get their first colonoscopy, regardless if there's any symptoms or signs of any problem. And once they have a normal colonoscopy, you only have to have one every 10 years.
I was going to ask, how often do you need to do that?
Every 10 years.
All right, so let's talk about skin cancer. I heard recently about a young woman, I mean under 30. It started, I think, with her something on her foot.
Okay.
A melanoma.
Sure.
And she passed away.
Sure. Melanoma is the scary skin cancer, but there's multiple kinds of skin cancer that we see: basal cell cancer, squamous cell cancer, and we do see this as our population ages. We see it in older individuals, but certainly younger people are getting it. We're in the sun a lot more, so getting a good skin exam, which I think is overlooked a lot of times, is very, very important. So really, the screening for skin cancer is just basically looking at the skin.
And one misconception too: this young woman was African American, so
doesn't matter. Sunscreen, even in African Americans, is very, very important. Starting with your children, they've learned that the earlier a child receives their first sunburn, increases their risk exponentially for skin cancer in the future.
All right, breast cancer?
Breast cancer, we talked about this in October when I was here before. Very important for women to get their mammograms starting at age 40. Certainly if they have other risk factors like a family member with cancer at a young age, you want to start earlier. But certainly at age 40, every year, women should be getting mammograms.
Every year. Osteoporosis.
Osteoporosis, that's important starting around age 60, 65 with bone scans. That would be the screening test for that. That's a special x-ray where they look at certain bones in your body, the density of the bones, and decide if you're at risk or not, and if you need to have extra calcium supplementation or something along that.
Is that more the most preventative, I guess?
It really is, yeah. You know, you might pick it up, you can pick it up early before it turns into osteoporosis. It's called osteopenia, and that just indicates that you need to be taking extra supplements to strengthen your bones. And osteoporosis, really the problem there is it leads to increased risk of fractures, especially in the elderly patients if they fall, easily break a hip, things of that nature. So you really want to try to keep your bones strong.
Now this next one kind of really scares me. It's cervical cancer, because I understand there are not really a lot of symptoms sometimes.
There's not, no, that's right. And so cervical cancer, the screening test for that is a pap smear. You should be seeing an OB/GYN or a gynecologist every year, at least starting at the age of 21. If you're sexually active, you need to be starting sooner than that. But a pap smear is just a basic exam where they take cells from the cervix, look at them under a microscope, and a lot of times they can even pick up cervical cancer before it occurs, when it's in its precancerous stages, and remove it before you have a problem. So it's very important to get pap smears.
All right, and again, that's every year?
That is every year starting at the age of 21. If you have 3 normal exams in a row, then you only need it every 3 years after that.
All right, let's talk about high blood pressure, stroke. Oh my gosh.
So those are very, very prevalent, obviously. Certainly in women, heart disease is the #1 killer of women in the United States, and I think that we don't realize that. And so it's very important that we start getting screened for high blood pressure even at the age of 18. They recommend getting checks every year, sometimes twice a year. You can get this at your local physician's office. Sometimes if you don't have insurance, or if your insurance doesn't cover this, there's lots of opportunity for free screenings. If you can control high blood pressure early on, you decrease your risk of heart disease, you decrease your risk of stroke, kidney failure even, and diabetes as well. That's another easy one to screen
and you're
for.
leading right into the next one that we should be. I'm diabetic.
Okay.
And so, you know, I know about the symptoms and all that, and how difficult and tricky it can be to try to keep it under control.
Absolutely. And diabetes is more prevalent now because of obesity. So people are getting diabetes at an earlier age. Diabetes can lead to issues with your heart, issues with your kidneys, and it's easy to check. You just have to get a blood sugar check. And this can be done at your primary care physician's office. They just look for certain certain values, and once you determine that you have diabetes, you can control it sometimes just with diet and exercise if you catch it early enough.
Okay, all right, that exercise piece, I need to work on that.
That's right.
You've already touched on heart disease, and February is Heart Month, and you're doing something special on February 14th.
Right, on Valentine's Day, I guess, for Heart Month, we are having a free screening for blood pressure at our local Walmart in Americus. I think we're shooting for around 10 o'clock in the morning until 2 o'clock in the afternoon. You can come by and get a free blood pressure screening. Certainly, if anything is abnormal, we'll refer you to the appropriate person for treatment.
Okay, and let me just say happy Heart Month to you early. Thank you so much, Dr. Kristin Collier, a general surgeon at Phoebe Sumter, and be careful on your way back.
Thanks for having us.
Well, coming up later on WALB, of course, we'll show you what people and organizations around South Georgia are doing to prepare for the winter storm. Once again, take a look at this. Don't forget, if you have not already, download the WALB weather app. We will keep you abreast of what's going on with our changing weather situation throughout, I guess, the next 24, 48 hours. And of course, we will have it live on WALB, NBC, and ABC. You can also check us out at